Hi, this is me, Sarah. I'm a clinical nutritionist specialized in nutrition therapy and community nutrition, and I am the part of Chef Mark St. Omar's team. Many people have this question in their mind whether metabolic syndrome is associated with PCOs. So in today's video, I will discuss with you in detail about it. So without any further ado, let's get started. Polycystic Ovary Syndrome and metabolic syndrome both are correlated. PCOS is a common endocrine disorder and many females worldwide are struggling with this disorder. It is a common form of anovulatory infertility. Metabolic syndrome is not a disease, but it is a cluster or constellation of various endocrine dysfunctions such as insulin resistance, hyperdyslipidemia, hypertension. Many scientific studies have proved that metabolic syndrome and polycystic ovary syndrome both are interrelated. If you have polycystic ovary syndrome, then the chances of developing metabolic syndrome increases, and also those females who are struggling with PCOS, their chances of developing heart disease and diabetes starts getting increased. Not deeply investigated, but it is said that women who are struggling with PCOS, they find it difficult to fall asleep and staying asleep. That's why they are struggling with sleep apnea too. As I mentioned before, metabolic syndrome is an endocrine dysfunction. It includes central obesity, hypertension, hyperdyslipidemia, and many other disorders. So if you are struggling with polycystic ovary syndrome, then you probably have these health conditions such as your blood pressure would be elevated and your triglyceride levels would be more than normal. Your HDL levels starts getting decreased. HDL is a good cholesterol, and women who are struggling with PCOS, their HDL levels starts getting decreased and their LDL levels starts getting increased in their body, as well as their visceral obesity starts getting increased, and different health conditions starts getting increased in the women who are struggling with PCOS. And it is not deeply investigated, but it is said that those females who are struggling with polycystic ovary syndrome find it difficult to fall asleep and stay asleep. Therefore, they suffer from sleep apnea too. If polycystic ovary syndrome left untreated, then different various comorbidities can start getting increased, such as cancer, type 2 diabetes, and various health conditions. So many females who are watching me right now, I would recommend you to change your dietary pattern, change your lifestyle, and increase your physical activity so you can manage the symptoms associated with PCOS, and definitely metabolic syndrome and PCOS can be treated quite quickly.